healthcare professionals need to find a more effective way to communicate with patients so that it doesn't necessarily take up more time. The conversation itself needs to be a little bit different. I think traditionally the relationship was very much that the patient was subservient and the doctor used a lot of medical terminology that meant that the patient didn't necessarily understand, and there was a very diagnostic way of thinking from a healthcare professional, and that was the way the information was relayed to the patient. Whether they understood it or not didn't really matter, because the patient just did pretty much what they were told to do. I think technology and the patient expectation that we have now, which has been driven a lot by other industries and their changing experiences, mean that we're not prepared to accept that anymore as patients. And I think for patients, we actually want a relationship where we do participate, where we understand the words that are being said to us. So the doctor needs to change their approach to be a little bit more like an interpreter, rather than using medical jargon. And I know lots of industries are guilty of using jargon, but I think this has very big implications for the patient, and I think it's important that they understand treatment options, diagnosis, different pathways for their medical care, and that they are an active participant in that conversation. I think what might be perceived to be a little bit more time spent up front in that initial conversation with the patient to help them understand and participate in the conversation will mean that there's better outcomes further down the track and efficiencies, if you like, to be gained as a result of the patient being much more participatory in the relationship in the longer term. Effectively, they could have a higher compliance to treatments, to medications, to outcomes, to all sorts of rehabilitation plans as a result of them being empowered to be in charge of that relationship. And I think that that's a great outcome for both the healthcare professional and for the patient. People can go to get a copy of my book by going to the URL, which is patientsforlifebook.com.au.